Hi everyone. As we have seen already in modules 5 and 6, we did discuss the major bones and their markings, which are the bone features. And in this module, we have already examined how the joints are going to be classified according to their structure and function. And we also have introduced the movements that will occur at the joints. Therefore, for this learning outcome, which is learning outcome number 8, we're going to be talking about selected joints of the body and cover them in regards to the bones that form the joint and how these specific joints will be classified. The types of joint that we're going to be covering in this module are the temporomandibular joint, which can also be called TMJ, the shoulder, the elbow, the hip, the knee, and the ankle joints. The temporomandibular joint, it's going to be a joint between the mandibular condyle, which is the structure right over here at the tip of the mandible, and the mandibular fossa, which is the depression that's part of the temporal bone. We can see on this magnifying view in a little bit more details the mandibular condyle right over here, and this would be your mandibular fossa, and inside you're going to have the joint cavity. Now, the mandible is the only bone in the skull that is a movable joint, and therefore, when you open it up in this direction, it will cause depression. When you pull it up, it will cause elevation. When you pull the mandible in this direction, it will cause protraction. And when you bring it back to anatomical position, it will cause retraction. As we can see from this image, since it has a joint cavity and the synovial fluid, it will be a diarthrosis. It can be mono or biaxial because it will produce either a hinge for elevation and depression or a plain joint for retraction and protraction. Next, we have what we call the shoulder joint, which is going to be formed by the humerus and the scapula. Therefore, the clavicle is not going to be part of the shoulder joint itself. With regards to the humerus, it will be the head of the humerus, and the scapula will be the glenoid fossa or glenoid cavity. The shoulder joint will allow several movements, as we can see over here. It will allow flexion and extension, hyperextension when you pull it even more posteriorly from the extension position, abduction and adduction, medial and lateral rotation, in addition to circumduction. It does have more freedom of movement than any other joint of the body because not only there's a looseness of the articular capsule within the joint, but also because the glenoid cavity or glenoid fossa is actually very shallow, and also because the head of the humerus is pretty big. And when we get to the hip joint, you're going to see how the acetabulum is very deep, so it will restrict the movement of the head of the femur. Now, because it does all these movements, we can definitely classify it as a triaxial type of joint and a ball and socket because it will be the ball will be the head of the humerus and the socket will be the glenoid cavity or glenoid fossa. Next, we have the elbow joint. We have talked a little bit already about the elbow joint. It will be formed by three bones, the humerus, the radius, and the ulna, and they will articulate at the elbow joint. There are several ways in which these three bones articulate at the elbow joint, but there are certain bone features of these bones that will always be articulating. And these are the condyle, right over here, which is the smooth, round, articulating surface of the humerus. On the medial side, this condyle is going to be divided into the trochlea, and on the lateral side, it will be divided into the capitulum. Therefore, the humeral trochlea will articulate with the trochlear notch of the ulna medially, and the capitulum will articulate with the head of the radius laterally. And this articulation will always be present independent if the elbow is in a flexed position or an extended position. And this type of joint is what we call a hinge joint, and because it only goes back and forth, flexion and extension, it will be a monoaxial or uniaxial. Next, we have the hip joint, which is going to be formed by two bones. This would be the femur and the coxal bone right over here. With regards to the bone features, you're going to have the head of the femur, which will articulate with the acetabulum, which is this big fossa that is made up of the three bones that form the coxal bones, so the ilium, the ischium, and the pubis. Now, this big fossa is what will limit the movement of the femur in the hip joint because the fossa is very deep compared to the shoulder joint. With regards to movement, since it's also a ball and socket and a triaxial, it will do the same movements that the shoulder joint does. So flexion and extension, hyperextension, abduction, adduction, medial and lateral rotation, in addition to circumduction. But again, it's going to be more limited than the shoulder joint. Osteoarthritis of a synovial joint is going to result from the aging and the prolonged joint wear and tear. These will cause, as we can see here, erosion and loss of the articular cartilage, which is not vascularized, so it's hard to maintain, and this will result in inflammation in the area that will cause the joint stiffness and the pain. The knee joint is going to be the largest and the most complex joint in the body. The knee joint is going to be formed by three bones, which are the femur, the tibia, and the patella. The fibula will not be part of the knee joint because the fibula only articulates on the lateral side of the tibia. Therefore, it's not part of the actual knee joint. With regards to bone feature, these are actually a little bit simple because the condyles, which are the smooth, round, articulating surfaces of not only the femur but the tibia, they will articulate with each other. So the lateral condyle of the femur will articulate with the lateral condyle of the tibia. The medial condyle of the femur will articulate with the medial condyle of the tibia. That makes sense, right? So this would be your medial side over here, and this is the tibia. Therefore, this would be your medial condyle, this would be your lateral condyle, and the femur sits right on top of the tibia. And we can also see how the patella is going to be articulating only with the femur at the patella surface, but it will be encased in this tendon of the quadriceps femoris muscle that will then insert right over here on the tibial tuberosity of the tibia. With regards to movement, it can only do flexion and extension, just like the elbow joint. Therefore, it's a hinge and a monoaxial type of joint. Here are the ligaments that form the knee, which are important ligaments. We do have a few ligaments that hold the knee together, but the main important ones are going to be the anterior cruciate ligament and the posterior cruciate ligament. And as you can see, the anterior, it does start medial, but then it runs posterior laterally. And the posterior ligament, it starts posteriorly, and then it goes from lateral to medial. So they sort of cross each other. And we can see these ligaments on these images as well. So this would be your anterior cruciate ligament, and this one over here is your posterior cruciate ligament. With regards to injury of the knee, the most common one is what will cause at the end an injury to the anterior cruciate ligament. Therefore, if you have a strong blow on the lateral side of the knee when it's extended, as we can see here on this image, it will actually cause 3 different injuries, and it will occur in this sequence. The first thing that will occur is that you're going to have the tearing of the tibio-collateral ligament, which is the knit ligament that runs from the femur to the tibia medially. Then it's going to cause a damage to the medial meniscus right over here. And lastly, you're going to have the rupture of the anterior cruciate ligament. Lastly, we're going to be covering the ankle joint, which is formed by 3 bones, which are the fibula, which is lateral. We can see a little bit of it over here. The tibia, which is medial, and the talus, which is the tarsal bone where the tibia will sit on top. More specifically, with regards to bone features, we're going to have the lateral malleolus of the fibula, the medial malleolus of the tibia, and the talus, or the condyle of the talus. We can see how this joint, and of course all other joints, they will have several ligaments, but the lateral malleolus, which comes a little bit further down, is going to be important to prevent the ankle joint from moving medially, and the medial malleolus of the tibia will prevent the ankle joint from moving laterally. With regards to movement, once it brings the foot up, it will do dorsiflexion. Once it brings the foot down, it will do plantar flexion. With regards to type of joint, because it's only going up and down, it's going to be a hinge and a monoaxial type of joint.